Hello everyone, you're watching sqadia.com and I am Hamad Haider. Today our topic is cerebral palsy. In this lecture, we'll be going through initially what is the definition of cerebral palsy. As you know that it's a neuromuscular disease and it's a kind of a problem. And once the motor neurons are affected, it results to severe disability. We'll be briefly going through its classification, how it affects the different parts of the body. We'll be going through the overview, whether it's unilateral or bilateral cerebral palsy. Then in the second section, we'll be going through how to diagnose the cerebral palsy. Usually these children, they are usually have an episode of ischemia or injury at the time of the birth. And usually they present with delayed milestones. So actually they are not coming by themselves, but rather the parents bring them to the hospital or to the doctor's clinic, whether regarding probably there's something wrong with our child. We'll be briefly going through what are the different type of motor diseases associated with cerebral palsy, how it's diagnosed. We will be briefly discussing the gait and analysis and what are the fixed versus flexible contractures. Then, as we'll be going through the symptoms, we'll be moving on to its management. As you know, that management includes history, examination, investigations, and then the treatment. Now, the treatments of the bony deformities which are associated with cerebral palsy, it's musculoskeletal abnormalities such as contractures, such as foot and ankle deformities, spine deformities, hip deformities. We'll be briefly going through the management in the third section. Now, once we'll be moving on to the fourth section, we'll be discussing a regional survey. That is, when we see a patient, then almost all the systems are affected. We have to start right from the foot, that is foot and ankle deformities, then there will be associated knee, hip, then spine, and then coming to the upper limb, there may be shoulder abnormality, elbow, and even hand and finger abnormalities. So we have to go through region by region in these patients so that what kind of abnormality which can be corrected and how it can be managed in a better way. Lastly, as the major problem is motor and gait problems, because these children either they have delayed milestones or they cannot properly walk. Therefore, the ankle equinus deformities and varus deformities, especially associated with cerebral palsy, are of prime importance because they have to be dealt properly so that at least children can barely walk or sit in the wheelchair. Thank you very much. Keep watching sqadia.com.